Wahito Architectural Program, Wahito Medical Center, Nyumba Mumbi One-Health Campus, Siron, Marmanet, Laikipia West, Laikipia County, Rift Valley, Kenya. 1. Executive Summary. The Wahito Medical Center is a visionary, integrated One Health campus to be developed on 10 acres of land in Siron, Marmanet, Laikipia West, Laikipia County, Kenya. The project combines a 300-bed rural referral hospital, 3 acres, a 5-acre elementary school campus, a 2-acre food processing and community enterprise center serving as the headquarters of Nyumba Mumbi DAO. Wahito is not merely a building project. It is a living prototype for decentralized global health infrastructure, integrating clinical care, education, food systems, economic empowerment, and blockchain-enabled governance. The project will be financed through retroactive public goods funding using the Actuate Token and governed long-term through a bi-cameral decentralized structure using Mumbi tokens under Nyumba Mumbi. The Boston Marathon for Global Health will serve as a global megaphone, mobilizing the African diaspora and global citizens through the year-long run wherever you are campaign. Wahito is infrastructure as destiny, a replicable model for rural transformation across Africa. 2. Synopsis. Wahito as a 3-component One Health program. Wahito integrates healthcare, education, and economic productivity under a unified spatial and governance framework. A. Medical Center, 3 acres. A 300-bed hospital designed as a rural referral and training hospital providing medical inpatient services, surgical services, general surgery, obstetrics and gynecology, trauma stabilization, pediatric care, maternal and newborn services, outpatient clinics, diagnostic services, emergency department, public health, outreach infrastructure. This facility anchors regional health access while integrating digital health records and blockchain-enabled financing transparency. B. Elementary school, 5 acres. The school will serve as a community education nucleus with pre-primary and primary classrooms, K, 8 equivalent, science and digital learning laboratories, library and resource center, nutrition and school feeding integration with the food processing facility, athletics field, and outdoor learning gardens. The school reinforces the One Health framework by connecting education, nutrition, preventive health, and economic development. C. Food processing factory and DAO headquarters, 2 acres. This component will include a pasho mill, maize and wheat processing, small-scale food processing and packaging facilities, agricultural aggregation point for local farmers, cold storage and logistics space, training center for entrepreneurship and food value chain innovation, headquarters for Nyumba Mumbi DAO. This facility supports local employment, school nutrition supply, hospital dietary services, community income generation, blockchain governance administration. 3. Geographical context. Location. Siron, Marmanet, Laikipia West constituency, Laikipia County, Rift Valley region, Kenya. The region is predominantly rural with dispersed settlements and agricultural livelihoods. Access to advanced medical services requires travel to distant urban centers. Wahito will function as a regional anchor institution, topographical and climatic considerations, semi-arid highland conditions, seasonal rainfall patterns, need for water harvesting systems, solar energy optimization potential, passive cooling design strategies. 4. Population to be served. Primary catchment, Siron and Marmanet communities, Laikipia West constituency. Estimated direct catchment, 80,000 to 150,000 people. Secondary referral, broader Laikipia County, adjacent counties in the Rift Valley. Demographic focus, maternal and child health, school-aged children, agricultural households, youth employment, and entrepreneurship. The hospital will reduce maternal mortality, neonatal mortality, trauma mortality, and infectious disease burden while strengthening preventative care. 5. Blockchain financing. Actuate Token model. Wahito will be financed through a retroactive public goods funding model using the Actuate Token. Financing framework. 1. Actuate tokens are acquired globally via decentralized exchanges. 2. Funds raised support phased infrastructure development. Phase 1. Site infrastructure and foundational utilities. Phase 2. Hospital construction. Phase 3. School construction. Phase 4. Food processing and DAO facility. 3. Transparent wallet reporting ensures accountability. 4. Contributors become stakeholders in a global health public good. This model bypasses traditional aid bottlenecks, mobilizes diaspora capital, creates digital participation in physical infrastructure. Wahito becomes a case study in decentralized infrastructure finance. 6. Long-term governance. Nyumba Mumbi and Mumbi tokens. Governance structure. Bi-cameral DAO. House 1. Citizens House. Mumbi token holders. Community residents. Diaspora contributors. Healthcare professionals. Educators. Actuate ecosystem participants. House 2. Professional and institutional council. Medical leadership. Educational leadership. Agricultural and enterprise leadership. Infrastructure and operations experts. Functions. Budget approval. Oversight of hospital management. Oversight of school curriculum direction. Economic enterprise strategy. Ethical and fiduciary standards. Mumbi tokens serve as governance participation instruments, not speculative assets, but civic tools. This ensures Wahito remains community-owned, transparent, adaptable, intergenerational. 7. Boston Marathon for Global Health. The Boston Marathon, organized by the Boston Athletic Association, serves as the symbolic and strategic megaphone for Wahito. The marathon represents endurance, discipline, global visibility, diaspora gathering power. Through the Boston platform, Wahito launches a global call. Run wherever you are. Build where it matters. The African diaspora, especially in the United States, is mobilized to participate in the year-long campaign, acquire Actuate tokens, fund the hospital beds, classrooms, and enterprise equipment. The marathon becomes metaphor and mechanism. 8. Run Wherever You Are campaign. Succinct overview. The Run Wherever You Are campaign is a year-long decentralized athletic and storytelling movement. Participants run in their local communities, share distances, photos, videos, raise funds through Actuate token acquisition, sponsor hospital beds, classrooms, or processing equipment. The campaign connects physical endurance to infrastructure creation, transforms individual miles into medical capacity, converts global movement into rural permanence. Each kilometer run becomes symbolic equity in Wahito. Preliminary spatial program. High level. A. 300-bed hospital, 3 acres. Core clinical zones. Emergency department. Operating theaters, 4 to 6 suites. Intensive care unit. Maternity and labor/delivery. Pediatric ward. Medical wards. Surgical wards. Isolation and infectious disease unit. Outpatient clinics. Diagnostic imaging. Laboratory. Pharmacy. Support zones. Central sterile processing. Kitchen and nutrition services. Laundry. Maintenance and plant room. Medical gas storage. Waste management. Staff housing optional future phase. B. Elementary school, 5 acres. 16 to 24 classrooms. Science labs. Computer labs. Library. Administration block. Multipurpose hall. Dining facility. outdoor playfields, agricultural learning gardens. C. Food processing and Dow headquarters 2 acres, grain intake and storage, milling facility, packaging area, food safety laboratory, cold storage, training classrooms, administrative offices, Dow assembly chamber, digital governance operations room, design principles. 1. Passive environmental sustainability. 2. Solar first energy strategy. 3. Rainwater harvesting and borehole integration. 4. Phased modular expansion. 5. Infection prevention spatial logic. 6. Cultural architectural identity rooted in Laikipia region. 7. Visible transparency of governance and operations. Conclusion. Wahito is not merely infrastructure. It is a declaration that rural Africa can finance, build, and govern its own future using blockchain, diaspora solidarity, and disciplined collective action. It is a hospital, a school, a factory, but also a proof of concept, a 10-acre seed for a decentralized civilization of health, education, and dignity. And from Siron, Marmanet, the model can scale.